The U.S. government has a plan to ensure that COVID vaccines remain free for uninsured Americans even after the public health emergency ends. The plan involves purchasing vaccines at a discount and distributing them through state and local health departments and pharmacies with a $1.1 billion investment. The federal government has been buying COVID vaccines from Pfizer and Moderna at around $25 per dose and providing them to the public for free under the emergency declaration. But as the supply of free vaccines dwindles, the government will shift to the private market, where the vaccine makers will charge around $130 per dose. This means that insured Americans will be able to access COVID vaccines as part of their coverage, without having to pay out of pocket. Private insurers and the government-run Medicare and Medicaid programs are required to cover all shots recommended by the CDC. But what about the uninsured Americans, who make up about 8% of the population? How will they afford the COVID vaccines that could cost them hundreds of dollars? The answer is that the government has launched a $1 billion program to ensure that people without insurance continue getting vaccines at no cost. The program will provide direct support to health centers and reimburse pharmacy chains per dose. The program will also cover the cost of COVID treatments, such as Pfizer's oral antiviral Paxlovid, while supplies last. The government will also leverage its existing Vaccines for Children program, which provides free immunizations to children whose families or caretakers can't afford them. The program will cover COVID vaccines for children after they move to the commercial market. The government's plan is to purchase vaccines at a discount from Pfizer and Moderna, using its bargaining power as a large buyer. The government will then distribute the vaccines through state and local health departments and pharmacies, which have been key partners in the vaccination campaign. The government estimates that this plan will cost $1.1 billion over 2 years, which is a fraction of the $171 billion it spent on buying COVID boosters last year.